Hi, welcome to lecture 7. Today we're going to be looking at the final section of stress, which is psychological and biological methods of stress management. Over the last few lectures, we've looked at the problems we can have once we're under stress. We also looked at the issues that can happen in terms of workplace stress, as well as things like daily hassles and life changes. Obviously, personality factors is also a key feature as well. So in society, we know that there are problems in terms of if people are under too much stress, they're going to get ill. Then there has to be ways of managing stress, and we're going to be looking at two different methods. So the psychological, that is all about the way the mind works about certain situations, the way we perceive things, and a biological, and their main assumption is that all our behavior is down to our physiological, that is our bodily processes. So therefore, the only way to alleviate stress is by dealing with the symptoms from our body. So we're going to be talking about first of the first psychological therapy. Yeah, so the main one, which they include in the specification, is stress inoculation therapy by Mitch and Boom. Don't worry about the name Mitch and Boom. Now, the key thing, first of all, I forgot to tell you is that with this particular section, there's no studies to learn. Do not learn any studies for this particular section. You've already learned enough previously in the other sections. The way I do it is that you can get away with not learning any studies and still come out with an amazing grade. So, first, psychological. Remember, don't get mixed up. Psychological, the way we think, and the basics that you need to know about stress inoculation therapy, which can be abbreviated to SIT, is that it is a type of cognitive behavioral therapy. So, very briefly, you may have seen this in abnormality. So, cognitive behavioral therapy is about changing the way we see things. So, changing our thought patterns, and once we change our thought patterns, then behavior would actually follow. Yeah, so CBT is like a big umbrella term, and SIT is just a technique within CBT. So we have different techniques. We have things like systematic desensitization is also a type of CBT in a way. So the key thing about SIT, stress inoculation training, is that they've tried to make you cope or deal with issues before the problem actually arises. So that's actually quite good. So we're inoculated, that is, we're protected against any type of future stressors at all. So we know how to deal with it if they do so arise, which is really, really good. So we're protecting ourselves in a way, a bit like immunization. So what happens is there's 3 stages in stress inoculation therapy, which you'll need to know in order to talk about it a bit more fully. And there's a nice mnemonic that you can remember, child support agency. So conceptualization phase. This is where the therapist and the patient, they meet together, they form some kind of relationship. So talk about who they are, what's going on in their life. So they develop some type of talking relationship. And what happens is the therapist helps the patient to deal with and to start looking at all the stresses that person has experienced in their life. They start looking at how they've dealt with those particular stresses, and what the therapist tries to do is they try to look at different ways of how they could have dealt with those particular stresses. So, for example, a stressor in somebody's life could have been, I slapped a girl when she said that I looked like a lion. Yeah. So they start to reconceptualize it. They try to look at it a different way. So instead of slapping the girl because she upset you and caused you some kind of stress, what else could you have done? For example, you could have said, "Oh, I'm not listening to you because you're talking a load of rubbish," and then walk away. So all the different types of things. So it's about changing the way we perceive certain situations. Yes, about thinking differently. So once they've gone through the conceptualization phase, they've got the skills acquisition phase, and it's all about rehearsing new types of really good adaptive behavior. So the therapist and patient talk through ways of what kind of things will be quite adaptive. So, for example, if your boss is giving you too much work to do, an adaptive type of behavior would be to have some kind of diary where you have a to-do list, and each time you do something you tick it off. That is an adaptive behavior, instead of, for example, going outside and smoking 25 packs of cigarettes. that is not so adaptive behavior. So it's all about learning and rehearsing new types of behavior. And in a final stage, application phase, it's basically they practice. So they use like things like imagery and visual imagery in the clinic or the therapist office, and they look at different situations that could arise, and they put their skills, they try to put them into practice. And what may happen as well is that that therapist may now ask the patient to also train and help other people. Okay, so the evaluation, so that's all you need to know. Yeah, three things: child support agency, conceptualization, skills, and application, and a bit about where it comes from. So it's about CBT and changing the way we think about the situation. So, good thing about this is it helps people to deal with things that could happen in the future. Very, very good, because so therefore it's treating the symptoms as well as the causes. Everything from the inside out is being treated. Very, very good. Um, Evidence has found that it has been more successful in treating phobias than systematic desensitization. Yeah, so that's also a positive as well. However, it will take a lot of time to do. Imagine developing a relationship between you and a therapist to be able to talk freely about what is going on. It just takes a lot of time and effort as well. It is a certain type of person who would have the time and effort to carry on this particular therapy, and it based on individual differences. This therapy could take like a month to like a year, 2 years. It all depends on individual people. It does cost a lot more money. Yeah, true say you can get it on the NHS for free, but the waiting list is really, really, really long. And if you do it privately, it could cost a lot of money, which could add to your stress issues as well. And finally, it is way too complex. There's too much stuff going on here. We don't know, for example, if we miss out the conceptualization phase and just go from phase 2 and then leave out number 3, we don't know if that would have as much benefit as just doing all 3. So it's just too complex. All the different bits, the whole role play that you have to do when you're practicing it, the whole visual imagery, all this kind of stuff. We don't know which one works the most effectively, hence why we say it's too complex. So that's all you need to know about stress inoculation therapy. Our second, like an add-on psychological method, which is always useful to have, is hardiness training. Again, changing the way we perceive or think about certain things. And remember when we looked at hardiness training, so remember when we looked at a hardiness personality, when we looked at personality factors and stress, how the hardy personality is somebody who's committed, who sees life as a challenge, and who's always that kind of who's got that kind of control. Yeah, so somebody's all control of their life, they're committed, they feel they're involved in their environment, and they see life issues as a challenge. Nice way to remember the key strategies in hardness training. So it's feeling really sweet. Yeah, so focusing. Okay, so what happens is, again, the therapist and the patient comes together and they focus on the key biological signs. That is, if you can recognize that your heart starts beating faster, or your pupils start pumping, or throbbing or something. So they come together and they recognize the signs, the biological symptoms and signs that show that they're under some kind of stress. On what they do, they relive the stress, so reliving stress accountants. So how they've dealt with situations beforehand and what has happened before, and they basically look at new ways of doing certain things or seeing things as now challenges. And then finally, self-improvement. They do new techniques, and they look at new, a bit like SIT. They look at new kind of strategies, and they try, and then what they do to make people believe that the problems in life are challenges and they're not actually problems at all. So they try to develop that kind of control, the challenge and commitment in that person's life. So to give them a more resilient personality, because as we found that if you're a hardy type of personality, you're more susceptible to the negative effects of stress. You're less susceptible, sorry. And evaluation has been used with sport by UK Olympic swimmers. So it has a real life application here, that it has worked with these UK Olympic swimmers to help them better improve their performance and to reduce their levels of anxiety. And a negative learnt behavior may be difficult to change. When we have those kind of stubborn people who refuse to change their personality, this will not work for them one bit. It's basically, you have to go back, undo your whole personality that you've been so used to for the whole of your life, to start looking at and having a brand new personality. It will take a long time, and it'll be extremely difficult to change, especially if you know any type of stubborn types of people. Okay, so that's all we need to know about psychological. This more so than anything, but again, use this as a back-in because it's going to be really useful, especially if they ask it for a 12-mark question. Now, we're going to be looking at the biological methods, which are what we call drug therapies or chemotherapy. It's the same thing. Chemotherapy just basically means a therapy using drugs. There's two drugs that you need to know, and the first one is benzodiazepines, and you can abbreviate this to BZs. That's absolutely fine. Okay. Now, BZs with drug therapies, what they do, they use anti-anxiety drugs. These are drugs that reduce your anxiety. Yeah, because when you're anxious and stressed over something, it's going to produce the stress response where we have a heart beating faster, high blood pressure. We all know what happens, especially if you go back to lecture 1 and look at the body's response to stress. So the key chemical with the BZs is GABA, and we all produce GABA naturally. Naturally is a neurotransmitter, or you can call it a chemical that we release naturally. And GABA makes us feel calmer. It makes us feel more relaxed about things. Okay, so what GABA does, so what the BZs do is they enhance this action of GABA, so GABA, in our systems. They enhance it, and once it's enhanced, we have an increased flow of chloride ions. Okay, so what happens, what these chloride ions do, they make sure that our neurons, our nerve cells, cannot be stimulated by any other chemical such as adrenaline or cortisol or anything like that. So to make sure we really feel the full effects of GABA in our system, making us a lot more calmer. Okay, it also reduces serotonin, which serotonin also has been linked with anxiety, so it reduces that as well. Okay, so our key evaluations of BZs is the ease of use. So you can take a pill each morning. There's no therapy to go to. There's no talking. There's no formal relationship. You take one a day. Simple as simple B. Yeah. There is evidence to support that um, taking drugs are more superior to placebos. And what placebos are, like sugar pills, they just don't do nothing to the system. So for example, some experiments have given people placebos, like these sugar pills, and they've given some people drugs, and they seek to see if there's a difference, to see if the issues are just more psychological or if there's actual a real problem. And what they found, that the drugs have helped people deal with stress more than just giving people ordinary sugar pills. That's wrong. And then finally, with every single drug, there's a possibility, well, not every single drug, but most drugs, there could be a possibility of addiction. You have side effects, which if you have side effects, you just cured one problem and added another problem to your life. And the thing about drugs, it cures the symptoms, but it doesn't deal with the cause of the problems, the what is actually causing you stress in the first place. Unlike stress inoculation training that deals with both the cause and the symptoms. It's very, very important that you know the key evaluation points. Okay, so this is a little diagram. I like showing things visually to show us what is actually going on. So these here are GABA neurotransmitters, these things here. These are called the chemicals, and this is our first nerve cell, our neuron. So this is what we call the pre-neuron or pre-nerve cell, and this is the post-nerve cell, so pre-post. And what happens is they send messages to each other. So this is the area that they send messages to each other, this area here. So what happens, this thing here, this is called a vesicle sac. It releases GABA, the nice relaxing chemical, into our we call this the synaptic cleft, the space. It releases it, and on the post neuron, we have every post neuron has specialist receptors. These receptors are specifically for particular types of chemicals. So these ones here are for GABA. Yeah. So what happens is the receptors receive the GABA, and it basically releases a channel of chloride ions, and what happens is no other chemical can stimulate this particular neuron. Only GABA can. Yeah, it's not gonna accept any other chemical there. Our second drug that you need to know is beta blockers. And what happens is, because we do stress response, it reduces adrenaline. So basically, a stress response, the sympathomedullary pathway, it activates adrenaline and noradrenaline. All BBs do, so you can call it BBs, is it binds to receptors. Remember receptors? Yeah, everyone's got special receptors. So it binds to receptors